Hello, and welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and I'm back with part 2 of our AI policy deep dive. We're walking through the Joint Commission and Coalition for Health AI guidance on the responsible use of AI in healthcare, and we're spending some time talking about an AI policy because this is one that we are recently in the home stretch for at Cleveland Clinic, and I was very involved from a hands-on standpoint with the drafting of our AI policy, walking it through the approval process. I wanted to share some of the challenges we had, some of the roadblocks that we were able to anticipate, and I wanted to sort of talk through what does this look like in reality. It's very easy for a Joint Commission and CHI to say, have an AI policy. It is not so easy to actually write one and get it approved. So if you didn't catch the last episode, the short version was we rewrote our AI policy at our own academic medical health system, large system, multi-hospital. And the biggest lesson that we learned was that the reason why AI policies kind of stumble is not usually the content, it's the scope, right? Our policy should give us a standard to measure performance of your AI governance and a benchmark to hold people accountable. So the operational SOPs, the philosophy, anything that's out of scope for artificial intelligence really does belong in a different document. So today I want to talk about what happens after you've been so disciplined and you've limited your scope and you've been so clear in your vision, because writing a good policy is one thing. Getting a good policy approved is another thing. And especially in a large health system, that momentum can really be difficult to gain as you're on your road to approval. So in the last episode, I talked a little bit about our timeline, said that we started in November 2024. I am recording this at the end of April 2026. And so we are just now in the final stages of getting our policy approved. We drafted from November 2024 to May 2025. And then the rest of that time has been formal approval, regional rollout. So 18 months total, right? And again, a lot of that time was not hands-on keyboard writing. One of the things that I do really need to call out, and I know I say this all the time, but I'm going to say it again because you can't say it too much. Our drafting was really collaborative. So I did a pass. I had a phenomenal group of collaborators that I worked with, clinical experts, legal experts, compliance, IT experts, all as co-authors. And as one of the benefits of bringing together this drafting committee was that we were able to do quite a bit of informal socialization as we were drafting. We would have our legal folks being able to bounce this off of other people, and they're able to see the work before it enters the formal review, which helps reduce the number of surprises as the policy makes its way through the actual formal approval process. We also, after we had a draft that we were comfortable with, ran it past our chief digital officer. And so the chief digital officer's job is to make sure the digital initiatives across the enterprise are coherent, right? So bringing him early for his pre-approval meant that we could have his perspective shape the policy from the start, rather than having us come up with something that met all of our other boxes and have him say, I don't like it at the end. So he approved the policy actually before it entered our formal approval guideline. And that approval was actually what made the rest of the process a little bit smoother, because we were able to go through, and when legal said, did you think about this scope? Did you think about that scope? What is the digital perspective on this? We already had that locked. One of our most important champions was our medical director for data and analytics. The line between AI governance and data governance is still blurry, right? There's a lot of territory in the middle there that could be assigned to one area or the other. And in our initial policy drafts, that line was even blurrier. But getting this partnership aligned really early helped us clarify what belongs in AI governance, what belongs in data governance, and making sure that our two pillars in our organization were not politically at odds. That was really important, and it really helped us have a smoother path towards approval. So if you want to take away from this, identify your domains where your overlap in your scope is the highest, and make sure that you have that leader at the table as you're drafting your AI policy. This can be tremendously helpful. One wrinkle that I did not anticipate that I thought was really interesting, and this may not apply in your health system, but policies may apply differently at different sites. In particular, at Cleveland Clinic, we have sites that have collective bargaining agreements. And those sites have a different policy standard than the sites that don't have collective bargaining agreements. So I did not anticipate needing a parallel policy structure. We made sure that we had the appropriate folks from our legal department on this early on, and our policy department themselves were tremendously helpful in navigating this because they have seen this before so many times. This was brand new to me, and I found their expertise absolutely helpful. So the approval architecture at your organization may be different, but generally approvals are going to flow through subject matter experts, so legal and compliance. Make sure that the digital office has signed off, and then the policy office does a final review, and then geographic leadership does their own review and sign off. So at Cleveland Clinic, the regional sites don't adopt separate policies. There's one policy for the enterprise, but a lot of that heavy lifting of that approval was done in the informal pre-approval meetings with legal, with compliance. I did maybe 1 or 2 review meetings with some of the regional leadership who did not get a chance to participate in the drafting and the pre-review. But by the time the policy had entered formal review, anybody who might have had a real hard stop had already had a chance to give their perspective, which was tremendously helpful. Okay, so if you're a hospital system, or if you're not a hospital system, if you still need an AI policy, if you're starting from zero, here is my advice. The Joint Commission and CHI have published the guidance that tells you that you need an AI policy. So you have that in your back pocket. We didn't have that when we first started this process. It's a little bit of an extra push, helps you get some momentum going. But don't let your policy become sort of the hanger on which everybody is hanging all of their hopes and dreams for artificial intelligence. The guidance is going to give you what you need to govern, but your policy has to tell your employees how it applies at your organization. So citing the guidance is not the same as operationalizing it. A good first step is write down exactly what you want your AI governance to do and not to do. And then from that, distill the underlying principles and start there. Start with your intention. If you have that as your North Star, everything else is going to fall out a lot more easily. Any sort of governance framework is going to give you the core elements that you need. So like a structure, a risk tiering. It's going to tell you that you need transparency, that you need explainability. And your policy's job is to say, how do these principles translate into our organization? One other takeaway, make sure that your scope is very clearly defined. If AI is appearing anywhere in your organization, you're going to need an enterprise policy. Even if you've opted for a decentralized AI governance approach, you still need a policy that is going to apply to every area that might be one of those spokes in your decentralized AI governance approach. So where I would advise not starting, don't start by modifying a data governance or a cybersecurity policy. You should definitely reference those because those will give you big foundational cornerstones for your AI governance, but you will miss the perspective that makes AI governance its own thing, and that's that the risk of artificial intelligence must be balanced by the benefits to your organization, to your patients. So the data governance is going to give you a solid foundation. Cybersecurity is going to give you a large measure of your risk, but you're going to need an AI governance perspective that's going to also have a way to capture and quantify the benefits of using artificial intelligence. And then just to circle back, I know I say this a lot, but you have to resist the temptation to let the policy carry everybody's hopes and dreams. The policy is a standard. It is a benchmark. Having these conversations is a great way to start to build a coherent AI vision for your organization, but that does not need to end up in the policy in order to be valuable. The writing process is really an active thinking process. I really wish that I had known earlier that a lot of the writing process was going to help me solidify my thoughts on artificial intelligence governance. I wouldn't have known that had I not gone through the process, but both the writing and the collaboration with other subject matter experts really helped me test and harden my thinking on AI governance. That was good work, and I'm really glad that I got a chance to have that experience. If you have any questions, if you have any further thoughts about writing an AI policy, I called this out in the last episode as well. Joint Commission and CHI mentioned that they were going to be releasing some playbooks with some additional details about literally how do you operationalize the guidance that came out late last year. I expect to see those in the public sphere very soon. But in the interim, if you've got questions, if you want to discuss, please feel free to drop me a comment, drop me a line. I would love to have this conversation with you. Until next time.